Okay, in this video, we're going to talk about sexually transmitted infections, or STIs. These were usually previously referred to as STDs, or sexually transmitted diseases. So that's literally the same thing, although the current language usually uses STI. So what are some examples of STIs? Here are some of the examples, and we are going to talk about most of them, okay? Here is a chart about where those particular STIs are found, how it can be spread, symptoms, complications, prevention, okay, treatment. If you want to read more, pause here, but I'm going to go through each STI that I'm going to focus on one by one. First, HPV. If you've had sex, the likelihood that you've been exposed to or recovered from HPV is very high. 8 out of 10 people who've ever had sex will have contracted HPV. It is a viral infection. It is the most common STI. There is a vaccination that will protect against some cancers as a result of protecting from HPV, those particular strains of HPV. It is spread by skin-to-skin contact with or without active symptoms. So a person might not know they even have HPV and could spread it to someone else. Condoms don't prevent HPV transmission because it can be spread through skin-to-skin contact. So during sexual intercourse, skin is touching. That is not necessarily the skin that would be covered by a condom. So HPV can be spread. But let's look at this. Okay, there are hundreds of strains of HPV. There are only a couple of strains that are responsible for most cervical cancers and some other reproductive cancers, and those are protected by the HPV vaccination. There are a couple of other strains that are responsible for the remaining parts of cervical cancers that are not covered by the vaccination. And then there are lower risk strains. Most cases of genital warts are actually from HPV infection. And then there are lower risk HPV strains, even lower. And most of the time it's like a cold. Like a cold is a virus. Well, HPV is a virus in a similar way, and your body just recovers. You clear up the infection, and there are no more serious consequences. But more serious consequences from types of HPV include genital warts, cervical cancer, and then other cancers, which could include of the anus, the vagina, and the vulva. So getting the vaccination protects you against some of that. Okay, so another STI is chlamydia. Chlamydia is a bacterial infection. It is transmitted by direct contact with a sore. The treatment is an antibiotic. Okay, so you can see symptoms are slightly different in people with penises and people with vaginas, although very similar. So there's discharge, painful urination. For people with vaginas, there might be bleeding. For people with penises, we could have swelling in the testicular area. Then there's syphilis. So it is a bacterial infection transmitted again by direct contact with the sore. The treatment is an antibiotic. So something that is important to note about continued antibiotic treatment is that there is the danger of antibiotic resistance. And that is being seen with some STIs as antibiotics are having to be changed. Okay. Something that is literally terrible about the study of syphilis is the Tuskegee experiment. It occurred from 1932 to 1972 in Alabama. It studied 600 men. 399 had syphilis, and 201 were in a control group. Penicillin became the recommended treatment for syphilis in 1947. However, in this study, No treatment was given to the men in the study. They continued to study the effects of syphilis with no treatment. And this was without having the informed consent of those men in the study. As a result, 28 literally died from syphilis. 100 more died from related complications. At least 40 spouses were diagnosed with syphilis as well, and it was passed on to at least 19 children at birth. Okay, the next STI, gonorrhea. Gonorrhea is a bacterial infection. It's often symptomless. So this ties into the importance of getting tested. So getting tested allows you to get treatment for your STI and reduce the risk of spreading it to someone else. The treatment is an antibiotic, but for this one in particular, there is a lot of antibiotic resistance. It is the second most common bacterial STI, which is tying into the antibiotic resistance piece. Okay, HIV. HIV is a viral infection. There is a medication called PrEP that can lessen the risk of contracting HIV if you are currently HIV negative. Okay? HIV does affect the immune system and can lead to AIDS, autoimmune deficiency syndrome, if untreated. But there are many medications that can help decrease the risk of HIV becoming untreated and leading to AIDS. It is important to note that HIV is not transmitted by insect bites, toilet seats, kissing, sharing silverware, and touching like hugging. Okay. Herpes simplex. It's a viral infection. So there's HSV1, that's face and mouth, that affects 60 to 95% of the world's population. HSV2, herpes simplex virus 2, is the genital version. And that affects about 16% of the world population. Something to note here. HSV1 does not know that it is oral herpes. So if someone has oral herpes and engages in oral sex with another person, they can spread oral herpes and it can become an outbreak of genital herpes on the person they are giving oral sex to. So it's not like HSV1 has to only be oral herpes. Okay, so they can affect other areas of the body. Okay, there is no treatment, but antiviral medications can reduce the spread and the severity of outbreaks. So it is spread by direct contact. Okay, there are other STIs like pubic lice, which are usually called crabs, genital warts, often coming from HPV. There's hepatitis B, and there's trichomoniasis, which is a parasite. So that's just a general overview. Having an STI is not something that makes someone a bad person or dirty. It literally means you were having sex. And sometimes you can do everything right and still get an STI. And even if you don't do everything right, getting an STI still doesn't make you a bad person. So what are some STI statistics? Well, youth, so people under 25, share a disproportionate share of STIs. So it's about 27% of the sexually active population, but it accounts for 50% of the STIs every year. So if you can see, the ages 15 to 24, so the under 25 group, accounts for a much higher percentage of the population. About the only thing that is not more common in younger people is syphilis. And HIV, it matches the percent of the population. But for herpes, for HPV, for chlamydia, and for gonorrhea, it is much more common in people under 25 when we compare to the percent of the population. So why might young people under 25 be more at risk for STIs? Here are some reasons. Insufficient screenings. So people don't get tested. Confidentiality concerns. Some people might not be willing to disclose their sexual behaviors. Who are they having sex with? Who are they having unprotected sex with? What kind of sex are they having? Also biology. So there might be something that younger people are more susceptible. Maybe lack of access to healthcare, like if you cannot get to appointments, might not have insurance, and having multiple sexual partners. So how can you reduce the risk of contracting STIs? Well, obviously, first is abstinence. That means literally don't have any type of sex. But we'll talk about it a little bit. That's not even 100%. Use condoms the right way every time you have sex, whether it's vaginal, whether it's oral, or whether it's anal sex, using condoms. Be in a long-term mutually monogamous relationship. So that means you're both only having sex with each other. Or if it is a group of 3 in a polyamorous relationship, you are monogamous with each other and you are all negative for STIs. So you get tested. Getting tested is a huge piece of it, right? And avoiding contact with sores on parts of the body of another person, okay? So just like in our current COVID epidemic, if you don't get tested, you don't know. And if you don't get tested, that doesn't mean you can't spread it. It just means you didn't know you were spreading it. So getting tested is an important part of being healthy if you are sexually active. So using condoms, again, this is one of the best ways to protect against STIs, using it every time you have sex. So don't put it on, way ahead of time before having sex. Read the package, check the expiration date. Don't store it in your wallet. It should be stored in a cool, dry place, okay? And use water-based lubricant. So don't use petroleum jelly or lotion or baby oil or something that's oil-based because it can cause condoms to break down, okay? Don't use an additional spermicide, as that can cause some irritation. Some condoms come with a spermicide already. So there's external condoms that are put onto an erect penis. There are internal condoms that are inserted into the vagina. And there are dental dams, which can provide protection when having oral sex, whether vaginal or anal. There is unfortunately a lot of stigma associated with STIs. The media tends to portray STIs very negatively. They're often used as the butt of a joke. Okay, and this affects a lot of people's feelings about having an STI. But there's not the same judgment about other infections. So we'll talk about that. Sexual health doesn't mean a lack of infection. You can do everything right and still get an STI. And even if you do everything or don't do everything right and you get an STI, you're not dirty, you're not a bad person. You're not unhealthy, okay? We don't have the same judgment about other communicable diseases like the cold, the flu, and other stuff like that. Like when you get a cold, there's not a lot of judgment like, you could have washed your hands more. You could have done this. And there's not people side-eyeing you, not wanting to be around you, even after you're feeling better. There is that same stigma associated a lot of times with STIs. And truly, if you're having any kind of sexual contact with another human being, you might get an STI. So you can even get an STI without sex. So oral herpes, cold sores can be spread through kissing. Oral sex, which some people fall into the category of, that's not sex, okay? Chlamydia, gonorrhea, syphilis, herpes, for example, can be spread through oral sex. If you share toothbrushes, razors, or needles, you can get HIV or hepatitis B and C. If you have a blood transfusion, you can contract HIV or hepatitis. Hepatitis A can be spread through contaminated food, and skin-to-skin contact. So that can spread things like HPV, syphilis, things that spread through active sores. But the thing about HPV is someone might not even have any symptoms, and it can still be spread through skin-to-skin contact. HPV is kind of like the cold of STIs, and odds are, if you've had any kind of sex, you've probably had HPV. Okay, so reconsider language. So avoid using clean to describe negative test results. So I was negative for HPV. I was positive for this. I was negative for this. Okay, and then just get treatment for the things that you test positive for. Okay, many things are treated with antibiotics. Some things are not. So again, avoid using clean and dirty. In class, we will personalize our discussion of STIs with a video about someone who has herpes. And so we'll engage in some discussion, questions, thoughts after that video. So what questions do you still have about STIs? Okay, so that's an overview of STIs, sexually transmitted infections. I hope you learned something new.